Hi, everyone. It's Shirley Farrar, and this is Encouragement on Fire. And thank you so much for tuning in this evening. Today, we are going to talk about Crohn's disease, part two. And I'm really excited because our segment is really going to deal with diagnosing Crohn's disease and also treatment of Crohn's disease. Before we get started, as you know, I like to talk in regards to what is updated in cancer. Okay, welcome to Encourage Minutes. And today we're going to discuss a few things. As of April the 3rd, 2023, there has been a new development, or I won't say new because it's been around, but it's new to the public. As of April the 4th, they were able to begin seeing the first patients. And what it is a first proton therapy center to patients in South Jersey. So it's in around the Cherry Hill, Voorhees, New Jersey area. And this is a combination or a partnership between Virtual Health and the Penn Medicine Hospital. So between the two of them, they have joined together because this is something new in the industry. It needs more research. And so when they're telling you, well, this is what it does comparable to the prior radiation for cancer, well, they can't tell you the longevity of what this means, but they can tell you on the recent research. So I encourage you to look it up. So one of the things from the first proton therapy for the radiation to get rid of the cancer in the body, the first thing is that it pinpoints precision, reducing side effects. So everyone knows when you have radiation, they're always going to tell you, well, there's side effects to the radiation. But in this, it minimizes it or reduces it. So I think that's an extra, that's a plus. And then also, it's used for all types of cancer. So that could be heart, brain, spinal cord. When you can't remove cancer from the surgery, because a lot of times when people even go through radiation or chemo, they go in and they take out some of the cancer, but there's sometimes that it's not able to be removed, and so there's a longer time for the radiation or for the chemo. So I'm saying to you, I told you guys that the doctor couldn't go in that spot that it was in and remove that cancer out. So for me, that would have been something that the doctor would have told me. This was an option for me. I'm really excited for those people who, you know, in the future may be diagnosed with maybe something similar that I had or in the same area. And they have the option, not that they have the cancer, but they have the option that they can use this wonderful new proton therapy, this new research that they have available to minimize the actual side effects. Look into it. Like I said, Virtual Health and the Penn Medicine Health or Hospital. Okay, so we're back to our segment talking in regards to Crohn's disease, and this is part two. And today we're talking about diagnosing Crohn's disease, and we're also talking about treatment. So there's a few things that we should know if we're going to help someone who is going through some of the symptoms that we talked about in our part one segment. So what we want to know is how does an individual get diagnosed? So the first thing is the doctor is going to do what? They're going to ask for blood tests. And there's two different types of blood tests. There is the FBC or the full blood count blood test, and the CBC complete blood count. This particular blood test, it actually checks for high numbers of white blood cells. Now, the one that is used particularly for Crohn's disease or diagnosing Crohn's disease would be the CBC, and that's the complete blood count. So I'm just gathering information for you in case this is something that you're going through, or you may be like, oh my goodness, I think this is happening to me. Your test, what is it looking for? It's looking for leukocytes. And what they're doing with this particular blood test, the CBC, is they're trying to figure out with the white blood cells if it indicates that there's inflammation or infection. That is what they're looking for. So then they can diagnose you properly. The second diagnosis that they would utilize is a stool test. So we go in and they take a sample of the fecal matter, right? I know a lot of you are thinking, well, that's what they do it with my animals, because I have two wonderful animals, Loca and Lotto, and I have to, every time I go to the doctor for their annual physical, that's what I take, a stool sample, so that we can find out if they are good, their blood is good. We're taking all these tests on them at least once a year, unless something happens during the year that I have to take them back. So there's no difference. We take care of our animals, but we should also be taking care of ourselves. And they're going to use that stool test to do that. Now, also, this stool test is also known as stool sample and is also known as stool culture. So you may hear the doctor say those two types of things. But for overall, what are they looking for? They're looking for parasites. Does this person have bacteria in their fecal? Or they're looking for that chronic diarrhea. Is there something else going on that they need to focus on? The third one is colonoscopy. I know you've heard this because we talked about it. Colonoscopy. Most people have colonoscopies in their 50s, in their 60s, and so forth. And a colonoscopy is something you do every 10 years. However, if you have a history of cancer in your family, it's really important. If you're at risk in any way, the doctor says you're considered at risk, you should have a colonoscopy every 1 to 3 years, depending on the risk that you are at. So you have to talk to your doctor in regards to that. Well, what are they looking for? They're doing the colonoscopy. It's an endoscope, thin tube with an attached light and a camera, and they're entering inside the colon area, and they're going in, and then what are they doing? They're taking a sample or a biopsy. I've talked about that. Whenever they're trying to find out there's cancer or tumor or anything, they're trying to get a sample so then they can study it and find out if there's any inflammation, which would lead them to believe that you have maybe Crohn's disease, right? That's a sign for them. It's not the only one, but it's a sign. But also, is there anything else in that colon that they need to study and find out if there's anything else? So there's multiple reasons why they would do the colonoscopy. Then there is the CT scan, or a computed tomography, CT scan. And this CT scan does images of the digestive tract. This is a computerized X-ray. And, the picture that I'm getting in my head right now is when I was sitting on a long table and there's just this looped circle around the table. I know many of you may have had the CT scan, but if you haven't and you're about to find out what this is, Google it. But it's a long table and it's this large, huge scan circle, half a circle, and it guides through and it takes pictures, x-rays of your body, and it's used to diagnose tumors, infections, and injury after an accident. So if you are in sports and the doctor may say, okay, from this fracture we need to get a CT scan. So I'm pretty sure you've heard that before, but it's also used to diagnose Crohn's disease. Now, also there is the upper gastrointestinal endoscopy, and then there's the upper intestinal exam. In this particular thing, the doctor they thread this long, I would say a thin tube, um, in your mouth and into your throat, and it's attached to it is a little camera. So some of you may have had this happen to you before, when the doctor is looking for different things, but they're looking for specific things. And the main thing is they're looking for inflammation. They're trying to take a biopsy or a sample of tissue. So I encourage you to look up all of this information, because remember, I'm not a doctor, and I'm just bringing some of this to your awareness, so you can look up these items for yourself, because if you're having some of these symptoms, you need to be aware of what is about to happen, just in case Crohn's disease runs in your family, you're having the symptoms, and what can I do moving forward? Also, I want to say to everybody, I want to take a little break for a second away from this, because this can really be intense, talking about diagnosing Crohn's disease. But I don't know if any of you see the lipstick that I have on, the shade that I have on. This particular lipstick comes from YSL, and it is called Velvet Matte Stain color 206. So I wanted you guys to know that, because I really like this. I don't know if you can see it, but it's really a beautiful lipstick. Oh, see, I just called my dogs whenever I pucker up. They're like, "Oh, here she comes. She's calling for us." So, but anyway, let's get back to talking about Crohn's disease. I just wanted to lighten things up just a little bit. All right, so let's now talk about some treatment. If you've been diagnosed with Crohn's disease, let's talk about what are the types of treatments that they have that you could consider. And remember, anything you're going to do extensive research. So you listening today on the podcast is like research one, where you're going to probably do 10 different research times. You're going to sit down and you're going to write out this information. So let's just consider this as like an entry level, where you're kind of looking at some ideas, and now you're going to sit down outside of the podcast and you're actually going to go into extensive research on some of these items to see if it's best for you. Okay, so the first one is antibiotics. Anytime there's something going on with our bodies, most of the time the doctor will say, we're going to give you an antibiotic because there is an infection, right? We got to treat the infection. We got to get that where it's no longer a threat to your body. So they're going to give you an antibiotic. And what they're trying to do is to minimize inflammation. They're trying to minimize whatever is going on in that particular area that's causing the infection. You can talk more about it with your doctor, because of course I'm not a doctor, so you have to talk to the doctor about it. But remember, we're giving you ideas, we're giving you understanding. So when you go in to see your doctor, there is a conversation, and it's not just you sitting there listening to the doctor. You can say, well, what about this, doctor? What about these antibiotics? Can you tell me the different types of antibiotics that are available in this situation, right? And then there is the second treatment is antidiarrheal medication. Now, many of you probably are familiar with them, either prescription medications like the Imodium AD, right? There are two types of Imodium AD. There's one that's over the counter, and then there's one under a prescription. So you need to talk to your doctor, because your situation may not be as severe as someone else's, and you can just take the one that's over the counter, or sometimes it is severe and you have to take the one that's prescription and be under the care of your physician or your doctor. Okay. And then there is the biologics. These medications, they're antibiotics, but I believe that they suppress the immune response. So remember, we talked about anytime you're taking medications and it's suppressing something, there could still be side effects, because that's not a natural thing. So what are some of the side effects that you may get from taking something like this? Hives, low blood pressure, pain, abdomen pain, headaches, fever, chills. Every time you're listening to the television and they talk about medications, all of a sudden you hear somebody get real silent and say, well, there's some side effects of it. They get real quiet, but now they're telling you all the side effects. And if you listen, you're like, what in the world? Why would I take that? Because the result you're going to get out of it is better than possibly the side effect. Now, sometimes if the doctor says you need to know the side effect of this, you should pay attention, because the side effect may not be something you actually want. And you're saying, I may just deal with what I'm dealing with because I don't want the side effect of that. Okay. One of the side effects that I had from taking the chemo was neuropathy. And I'm telling you, it was a struggle dealing with it. It's getting better. I'm at the end of it, but it still was a struggle where some people, it's an ongoing, lasting neuropathy the rest of their lives. So the doctor told me about that. And that was something I had to weigh the pros and the cons. Is this something I want to take a chance on? Is it something that, well, is there an alternative? For me, I felt I needed to do the chemo. And even though the side effect would have been possible neuropathy. Okay. Um, and then there is the bowel rest. I know you're thinking, what? Bowel rest. Exactly. So what the doctor is going to ask you to do is to fast. So some of my faith-based people, you know all about that. Once a week, you're fasting because you're probably fasting for spiritual reasons, for faith reasons. Sometimes we're fasting 40 days. Sometimes we're fasting 2 weeks. It all depends on what the time of the year is or what we've been led spiritually. So a doctor is going to ask you to do bowel rest, which is fasting. But many times during this process, they're going to give you like an intravenous nutrition, feeding tube, something like that. If it's a long period of time that you need to have bowel rest. So like I said, these are things you can have conversation with your doctor if they are saying this is your diagnosis. See, if they're not saying that, you don't have to worry about this, okay? Because remember, these are treatments to the diagnosis. And then there is so you have the corticosteroids. So that's cortisone, prednisone, and other corticosteroids. Now, some of the side effects from that corticosteroid is leg swelling. It also could be blood pressure. Your blood pressure has gone up, and weight gain. Remember last month we were talking about our BMI, those type of things. And sometimes we're affected by the medications that we use. So in this case, this particular medication would affect someone's weight gain. Not everyone, but a large number of them. That's why it's a side effect. The other one is immunomodulators. This is drugs that calm the inflammation by suppressing an overactive immune system. Well, it's one of those things that's going to make you drowsy. That's a side effect. It's going to make you fatigued, low blood cell count, and neuropathy. See, there are many things that can cause neuropathy, and medications, many medications do that. So you have to weigh the pros and the cons of everything. And then lastly, a treatment would be surgery. Remember, we're always going to tell you, exhaust everything else before you need to go under the knife. So you don't want to have surgery first. You want to go to antibiotics, right? Anti-diarrhea medication. You want to go to biologics. You want to go to bowel rest. You want to do corticosteroids. You want to do immunomodulators. Then, okay, doctor, we've exhausted everything. And I know the last one is the surgery. If you get to that point, most people, the other items on this treatment list will help and to at least alleviate some of what they're going through. However, surgery is one of those things. It's going to be that last suggestion from the doctor. And this one does not mean that it's a cure. So you need to keep that in mind. Is it worth it? It's not a cure, but it's going to help you in some of the blockage, the bleeding, all the different things that you're going through. And yes, there are side effects from the surgery. So you need to keep that in mind. And some of the things that the doctor's going to talk to you about, which you can ask questions: pneumonia, scarring in that area, anemia. You're going to go through all these different things, possibly some people more than others. Sometimes you can even have an allergic reaction to the anesthetic. So I just want you to be mindful. Even there could be blood clots after the surgery. All of these things are a side effects and a reality for the treatment process, and you need to be aware of that. Like I said, I'm not a doctor, but I'm sharing with you some of the information that I've gathered. And I'm saying to you, I want you to be knowledgeable as you are going before your doctor and you're talking with them, because they want to know history. They want to know side effects you're having. So then they know how much medications, they know what exactly they're doing. I'm telling you, by having the information, writing down all the information that I needed to do while I was going through my treatments, while I was doing these things, it made the difference. And the doctor could diagnose me properly, adjusting medications, adjusting all the things that was necessary, so then I can stay on treatment and that I could recover properly. Trust me, you guys, all of these things matter. Knowledge, information, knowledge, all of it's important. So today we talked about, diagnosing, um, how do they diagnose a person who has Crohn's disease. Last week we talked about symptoms. And also this week we talked about some of the treatments that may be applied to a person's situation. So I'm saying to you, you always want to try preventive. But remember, they said some of these things are out of your control. But let me say this. Next week, we're going to talk about have a healthy lifestyle by eating certain foods and avoiding other foods, which will make your life better if you have been diagnosed with Crohn's disease, right? And there's certain exercises that you should be doing and some things you should be avoiding. So we're going to talk about that in next week's session, part 3, talking about Crohn's disease. So now I want to talk to all of you again very briefly about our encouragement on fire. We always welcome your donations to, again, assist us in moving forward and doing all the things that we do to provide you information on chronic disease and all these things that are going to help you when you're going before a doctor or a nurse practitioner to help them better diagnose you. So if you are feeling, again, generous, down at the bottom, there is a QR code for you to scan and to go to our website and to donate. Like I said, all it takes is a few dollars to help out in the cause. All right. Thank you so much for your contribution. So I also want to encourage you that if you look up this way, yeah, we have our telephone number, 856 857 1859. We are receiving information in regards to people who have been taking some of our advice and putting it into action. We'd love to hear your stories. If it's working for you, if it's not working for you, we want to be able to report back to the viewers. In addition to that, if you have testimonies about how you're becoming victorious in this, we want to hear that as well. And we'd like to share your information, maybe not your name, but we want to share that information to our viewers as well. And because we know that people are getting better because they're applying the work. You know what we believe, faith and works together make the difference in our lives. And so we want to encourage you to stay balanced, because it's really necessary to do that. If we have faith and we have no works, doesn't quite work. If you have works and you have no faith, again, it only goes but so far. So we want to make sure we have faith and works so these things can work together for our good, right? That's really important. So again, I want to say thank you so much for tuning in to Encouragement on Fire. And next week, we're going to talk about Crohn's disease again, part 3. But this time, we're going to talk about the foods that are good for us to eat and some things we need to avoid if for some reason you've been diagnosed with Crohn's disease. Thank you so much for tuning in. I'll talk to you soon. Bye-bye.